Hola, muy buenos días.
Hello, good morning, and thank you for joining us in this press briefing of PAHO on the COVID-19 pandemic in the Americas this Wednesday, October 27, 2021. My name is Sebastián Oliel from the Communications Department of PAHO. The session will last about an hour. As every week, we have received your questions by email, and you will also be able to ask questions through the Q&A button. We ask you to please always put your name and your outlet when you send your questions. We have simultaneous interpretation into English, French, and Spanish, and English, and you can click on the interpretation button. Today, Dr. Etienne, director of PAHO, will not be joining us, and therefore Dr. Jarbas Barbosa, Assistant Director, will talk about vaccination, epidemiology, and the threat of climate change. In his remarks, Dr. Barbosa is accompanied today by Dr. Ciro Ugarte, Director of the Department of Health Emergencies, and Dr. Sylvain Aldigueri, Incident Manager for COVID-19, both, of course, from PAHO as well. I will invite Dr. Barbosa to share his opening remarks for today's session. Dr. Barbosa, over to you.
Thank you for joining today's press briefing. Over the last week, the Americas reported over 800,000 new COVID infections and 18,000 COVID-related deaths, the lowest COVID figures in over a year. We have reason to be optimistic, but we must remain vigilant. Across North, Central, and South America, COVID infections and deaths are decreasing, with a few exceptions. Belize is reporting a sharp jump in COVID-related deaths, and Paraguay saw a doubling of COVID cases in the last week. Many of the Caribbean's larger islands are seeing downward trends, including Cuba, which for months has been managing a large COVID outbreak. But some smaller islands are just now reaching their first pandemic peaks. St. Kitts and Nevis, Barbados, Anguilla and St. Vincent and the Grenadines are now reporting their highest number of COVID infections and COVID-related deaths. That's why it's critical that countries continue to implement public health measures like mask wearing, social distancing, and limiting large gatherings to bring these outbreaks under control, especially as many countries are still struggling to expand vaccine coverage. Today, nearly 44% of people in Latin America and the Caribbean have completed their COVID immunization course, thanks in large part to vaccine donations made bilaterally or through COVAX. Today, twice as many people in Latin America and the Caribbean are fully vaccinated against COVID than in August of this year. And while our region has done a great job at accelerating immunization coverage over just a few months, more than half of people in Latin America and the Caribbean remain unprotected. In Guatemala, St. Vincent and the Grenadines, Jamaica, Nicaragua, and Haiti, less than 20% of people have been fully vaccinated. But the good news is that over 3 million more doses will arrive in our region through COVAX this week. And deliveries are expected to pick up in these final months of the year, so we can continue to address one of the biggest challenges affecting our region, vaccine inequity. But today, as leaders around the world head to Glasgow for the COP26 conference, I want to talk about the biggest long-term threat to our public health, climate change. The health of our planet and the health of our people are interlinked. Around the world, more than 12 million deaths every year are associated with environmental risk factors. High temperatures and air pollution have led to a rise in cardiovascular and respiratory diseases. Wildfires and droughts have led to crop failures that have not only impacted the livelihoods of our agricultural workforce, but also increased food insecurity in our region. Extreme weather and rising temperatures have changed our ecosystems and displaced people from their homes, often forcing humans to infringe on natural habitats and animals to move to more hospitable conditions. This has led to a rise in vector-borne diseases like Zika and Chagas. And dengue, which typically follows a seasonal pattern, is being detected outside of its normal cycle as temperatures have warmed and as wet seasons have prolonged. And these episodes are increasing in scale and frequency. A child born today is expected to experience twice as many wildfires, nearly 3 times as many droughts and floods, and nearly 7 times as many heat waves over their lifetime compared to a person born in 1960. Our health systems will be challenged by these threats, and the same health systems have the primary responsibility to do no harm and reduce their environmental footprint. That's why we are encouraged that for the first time ever, health is taking center stage at this year's Climate Summit. Ahead of the summit, PAHO has launched an agenda for the Americas on health, environment, and climate change that offers countries a plan of action to reduce the burden of environmental risks on the health of our region. I want to emphasize 3 points from this plan. The first is the importance of collaboration. Climate change is a health issue just as it is a socio-political and economic problem. That's why we need these sectors to work together to build more comprehensive preparedness plans that address the health impacts of climate emergencies. To better anticipate and prevent future threats, health and animal surveillance, as well as climate and environment information systems, should be integrated to build a more robust early warning system for future crises. The second point I want to make is that countries must invest in their health system. As we've seen throughout the COVID pandemic, the success of our responses rests on our health system's ability to adapt and to expand to meet people's needs. So, countries must invest in their health systems so they have the staff, training, and resources to face future climate risks. But the health systems should not just be robust, they should also be resilient. PAHO has been working with member states in the Caribbean to build safer, greener, climate-resilient facilities that can continue to function in the face of changing climate and extreme events like hurricanes and rising sea levels. But this brings me to my third point. Health must be part of the solution. The health sector itself is a large contributor to greenhouse gas emissions, with estimates suggesting it may be responsible for 5 to 10% of carbon emissions worldwide. We can improve by lowering carbon emissions from energy, heating, and cooling operations of healthcare facilities. And we can adapt our health systems by building greener facilities and by lowering emissions at every stage of our supply chains, from production to transportation. Climate change is a real and long-term threat that should be addressed through lasting solutions. Extreme weather events that result in health emergencies are just one of the risks we face. Scientists have long warned us that left unaddressed, climate change would transform our environment, our food systems, and our living conditions, all of which have potentially devastating consequences for our health. The COVID-19 pandemic has offered a snapshot of how unprepared we are for such a disruptive event. But today, we have an opportunity to build on the lessons from the COVID pandemic to prevent future crises and to strengthen our ability to respond to them when they arrive. We hope our leaders will seize the moment. Thank you.
Muchas gracias, doctor Barbosa. Vamos a pasar ahora entonces a...
Thank you, Dr. Barbosa. Now we're going to go to the questions that we have received, as well as the questions we have received via email and on the chat. First question is from Andrea Hamilton from Magnetic Media in Turks and Caicos and the Bahamas in English.
Effect of COVID-19 per comorbidity, whether it is more detrimental to people with diabetes or obesity or hypertension, for example, or have we kept a database of how many people with comorbidities have died to COVID-19 in the Caribbean and Latin America, where that death is due to COVID-19? Dr. Aldigueri?
Yes, thank you for this question. Although the line list of cases provided to PAHO describing comorbidities of these cases is not complete for all the countries of the region, the data shows that comorbidities are clearly a factor associated with COVID-19 severity. The more comorbidities a person has, the higher the risk of severe COVID-19. We know how many people are at risk of severe COVID-19 in Latin America and the Caribbean from our prospective studies. We are talking about 22% of the population. That is more than 145 million persons, so huge numbers. Regarding the Caribbean countries, part of the Caribbean community, CARICOM, where we have observed the highest prevalence of cardiovascular disease, including hypertension, diabetes mellitus, and chronic kidney disease, the estimation of the Pan American Health Organization in collaboration with the London School of Hygiene and Tropical Medicine is that we have up to 29% of the population with at least one underlying condition, therefore being at risk for severe COVID-19. Therefore, for Latin America and for the Caribbean, you would clearly understand the core messages of PAHO regarding vaccination with people, for people with comorbidities. I hope I have answered the concerns of the journalist. Thank you.
Muchas gracias, doctor.
Thank you, doctor. Next questions from Ana Cruz, journalist from Confidencial from Nicaragua, and also from Livia Lopez from La Prensa Nicaragua. They both ask similar questions. They want to know what has happened with the shipments of Pfizer vaccines scheduled for last year for Nicaragua. Why was there a delay, and when is it estimated that they will be arriving in the country? Dr. Ugarte, thank you, Sebastián, and thank you for the questions. Yes, in fact, there were some issues related to documentation that the vendor had to complete to send vaccines to Nicaragua. And thanks to coordination with the Washington and Managua PAHO teams, it was possible to accelerate the process, and a quick response from the government of Nicaragua was obtained, and the vendor has now all the documentation and all the issues were overcome. So now everything is ready for the 305,370 doses arrive on Friday, October 29. These vaccines, together with the vaccines that had arrived before from COVAX and generous and significant donations from countries, will help reduce the risk of COVID transmission and will protect the population. The levels of coverage and vaccination continue to be very low still in this country. Thank you. Thank you, doctor. Another question from Ana Cruz from Confidencial in Nicaragua is whether the health ministry in Nicaragua has reported PAHO as to when the report on circulation of variants will be ready. Dr. Aldigueri, thank you for your question. Even though at this point in time we do not have a report on detection of variants of interest or variants of concern in Nicaragua, we do know that the public health laboratory of the National Reference Center of the Ministry of Health are making efforts to generate the necessary data critical uh, for surveillance, but also for the scientific community as a whole. On the other hand, it is important to have a sub-regional approach, and thanks to the efforts of several countries in Central America and the very active cooperation of the Corneas Institute in Panama, which is one of the reference laboratories for the genomic surveillance network. It has been possible to show circulation of alpha, gamma, and delta variants of concern. We emphasize the importance, therefore, of maintaining and strengthening genomic surveillance, which allows us to timely detect the presence and transmission of variants of interest or variants of concern. PAHO will continue to work closely with all countries in Central America to increase the diagnostic capacity even more. Thank you, doctor. Next question on the chat here from Alina Dieste from AFP. It has to do with the words of Dr. Barbosa's. Alina says that Guatemala, St. Vincent, the Grenadines, Jamaica, Haiti continue to have less than 20% of their population completely vaccinated against COVID-19. And she asks, how many of the more than 3 million doses that will arrive in the region through COVAX will be going to these countries? So where are these doses coming from, if there are donations, and if so, what countries are making the donations, and what brand of vaccines are they? Dr. Barbosa, over to you. Thank you very much. No doubt, one of the most important objectives is that all countries in the region are able to reach protection of at least the most vulnerable groups of the population, which are about 20% of the population. So we are working together with COVAX in order to have these countries as priority countries. COVAX agreed that for November and December, vaccine allotments will be sent to the countries with the lowest coverages. So this will ensure more protection for those countries. And we're also mobilizing donations. And for all the donors, we offer detailed information on what doses have already been administered in each country and about the capacity of absorption that each country has so that they can receive the vaccines according to their capacity to use these vaccines immediately. Many of these countries are going to be receiving vaccines. And just to give you an example, with Haiti, there is 668,000 doses of the Janssen vaccine, which is a single dose vaccine, and this can be very helpful for Haiti. We also have the single dose of Moderna, which have been approved for the country. In Guatemala, we're working with 2 million doses that will be arriving in the country in the next few weeks, so the country is able to broaden access to vaccines. And for Jamaica, about 370,000 doses will be arriving in the country in the next few weeks. All of this is given as detailed information to the countries so that they are ready, and to make sure ensure that all are able to protect their most vulnerable groups and save lives, which is the main objective of COVID vaccines. Thank you. Thank you, Dr. Barbosa. Now, next questions are from Mexico, from Blanca Valadez from the Milenio Group, and also Melina Ochoa from Uno TV, Mexico City. They want to know whether Mexico has seen cases of Delta and the Mu variant, but Melina also wants to know if there is a circulation of the Mu variant and if the AY.4.2 variant, which is descendant of the Delta variant, has been seen in Mexico and in the region of the Americas. Dr. Aldeguerri. Yes, thank you very much for your questions. We have a few questions here, and let me articulate my response accordingly. Regarding detection of Delta and Mu variants in general, and even though less frequently, it's not impossible to have co-detection. I'm not talking of co-infection, but co-detection of more than one variant in one single patient in areas where these two viral strains are circulating at the same time. Mexico reported one case of co-detection of Delta and Mu variants, and this event is being investigated, and protocols, very precise protocols, are being applied for this. Now, regarding the Delta variant of concern, genomic surveillance has characterized over 30 sublineages distributed throughout the planet extensively, and some of these sublineages have additional mutations. So all these sublineages are classified as Delta, including the AY.4.2. And at this point in time, there is no solid evidence of any additional threat or any change in its profile of transmission. The sublineage AY.4.2 has been detected mostly in Europe. However, in other regions of the world, such as in the Americas, it has been detected as well in less than 10% of the available sequences in our region. To date, the sublineage AY.4.2 has not been detected in Mexico. At present, the Delta variant is detected in 99% of sequences coming from the whole country, the whole of Mexico. And finally, regarding the last point, in Mexico, the number of deaths has decreased, but it is still high. The safety of patients should be ensured, and also the medical care. The vaccine reduces mortality and severe forms of the disease, but as in prior moments, I would like to emphasize the holidays, for example, Dia de los Muertos and other holidays at the end of the year. They are very high risk for reemergence of COVID-19. So in this context, we need to redouble the efforts of risk communication so that better compliance with the non-pharmacological public health measures are maintained, as well as maintaining the campaign for vaccination of as many people as possible. Thank you. I hope I answered your questions. Thank you, Doctor. Next question is from Henry Cárdenas from La Pensa in Panama. It says Panama continues to take steps to go to the new normal in the context of the pandemic. What recommendations does PAHO give to Panama to avoid new outbreaks or spikes in cases? The second wave really hit the country very much. So what can you tell us? Dr. Ugarte, over to you. Thank you, Henry, for your question. In Panama and in several other countries, we have observed a sustained decrease in the number of cases as well as in the transmission, given the implementation of the appropriate use of masks, keeping physical distance, hand washing and hygiene, and also the increase in the vaccinated population. So when holidays approach, as those mentioned by Dr. Aldeguerri, holidays at the end of the year and others, the people are enthusiastic and they want and they look forward to gather with friends and family, and so they tend to relax the public health measures. And this is one of the signs that we should really be on the lookout for, because even if people are vaccinated and even if there is a high rate of vaccination, as is the case in Europe and other countries that have high vaccination rates, we've seen spikes of cases because people are too optimistic and let loose with keeping the measures. These measures need to continue to be complied with, as in particular the use of masks in public, keeping physical distance, as well as washing and having general hygiene of the hands. And also, in particular, as in the case of Panama, to continue to vaccinate people. If you're a Panamanian person, please go ahead and get the vaccine. Panama has coverage of about 70% already, and with the available vaccines, they could quickly reach higher levels of protection and thus protect lives and reduce transmission. Meanwhile, we still have the measures that have proved to be effective, and not only for Panama, but for other countries as well. Just continue to do what has proven to be helpful to reduce transmission, to reduce deaths, and to improve the general health and condition of the population. Thank you, Doctor. We have several questions now related to vaccination in children.
Sauquet,
We
de efecto Concuyo en
as
Venezuela.
from La Prensa, now from Efecto Concuyo, and also from the Tribune in Bahamas. Henry Cardenas is saying that there is a great deal of expectation for vaccination of children younger than 12. What is the information PAHO has, since this is a significant population in our countries? Mariana Soquet from Venezuela is also asking whether PAHO is recommending vaccination for youth younger than 18, as it has started already in some countries of the region, and how is the authorization process working for this group? And also from the Tribune, we see that an FDA panel is recommending the Pfizer vaccine for children 5 to 11 years of age at low doses, and he is asking whether PAHO is supporting this recommendation. Dr. Barbosa. Thank you very much. We have several questions. Let me answer all of them. First, the regulatory authority with the country or WHO authorization for use at a specific age. And this is just not a bureaucratic request. All of the data has to be provided so as to verify that tests were conducted, trials were conducted for that age, and that the vaccines are safe and efficacious for that age. So far, only 2 producers requested WHO authorization for emergency use in children, Sinovac and Sinopharm. Both requests are being analyzed by WHO committee. So only upon completing the process, we will have a recommendation and authorization by WHO to use the vaccines in children. But this changes with the country. For example, in the US, Pfizer has already requested the FDA, that is the regulatory authority of the United States, authorization for administration in children. The panel has already presented a recommendation, and final decision is pending by FDA and CDC to administer the vaccine to children. This is valid in the US. So in each country, producers are asking the regulatory authorities to consider their data, their clinical trials, and the countries will be implementing this and also implement recommendations for use in their own countries. This is a sovereign decision of a country that we cannot support or criticize. This is a sovereign decision. The country has the information and makes their own decision. At PAHO, we follow WHO recommendations as well as recommendations for the use of vaccines by WHO. So let me remind you, let me underline that the priority groups in the region are not the same. We still have a long path to cover the most vulnerable members of the population. In average, Latin America and the Caribbean, less than half have a full schedule. So we still have many older adults that are at risk of death due to COVID-19. We have adults that have hypertension, diabetes, cancer, that have an enhanced risk of developing a severe form of COVID-19. So as long as the regulatory authorities analyze data seriously and in depth, we will continue to vaccinate the most vulnerable groups. We will extend vaccination for adults to save their lives and also to support control of COVID. Thank you very much. Thank you, Doctor. We have some questions on Bahamas by Anduani Smith from ZN News in Bahamas, and similar from Ariel Bowen from the Tribune in Bahamas in English.
Bahamas is a nation with multiple islands spread across miles and miles of water. The hospital is located in the capital island of Nassau. With both cases and deaths rising in the farthest and most isolated of islands, how do authorities manage the spread? Y a Ariel pregunta similar, dice, health officials are trying to deal with clusters of cases in some outer islands. Is it entirely possible to deal with COVID clusters without lockdowns? And what other measures would PAHO suggest? Dr. Aldigueri?
Thank you. Thank you for both questions from both journalists. And for flagging the specificities and the challenges of the COVID-19 response in an archipelago country as the Bahamas. So from the geographical point of view, it's a complex situation. Good disease surveillance and early detection and control is essential to control the spread of the SARS-CoV-2 virus. Testing should be available to all symptomatic cases and, when possible, to contacts. All cases should isolate and contacts should quarantine. Contact tracing should be done when cases are identified, so clusters can be identified and shut down. Vaccination should be encouraged and should be accessible to all eligible people according to the national regulations. So you see at this point all the importance of the primary healthcare network, including in remote islands of the Bahamas archipelago. But in addition, adherence to public health and social measures should be maintained to break transmission, to stop the spread, with the use of masks, hand washing, physical distancing, and avoid crowded and poorly ventilated places. What we know from the reports, the regular reports from the Ministry of Health of the Bahamas, is that they are actually implementing these actions already. And the ministry has expanded the testing thanks to the use of antigen rapid test and is rolling out very strict and organized contact tracing activities. I hope that I have answered the concerns of both journalists on the situation and measures in the Bahamas. Thank you.
Gracias, doctor. Próxima pregunta.
Thank you, doctor. The next question is by Michael from Depiction Media. This is related to vaccine boosters.
Be waiting for more countries to achieve over 85% vaccination rates before starting booster shot programs for the general public. Some states and provinces in the United States and Canada are announcing booster shots program, while Caribbean and South American countries are barely at 50% vaccination. Dr. Barbosa.
Thank you, Michael, for this very important question. You know, indeed, one of the main problems that you need to face is the inequality that we have. So many countries are struggling to vaccinate the most vulnerable groups, while other countries are already discussing third doses. So it's important to highlight, to stress again that it's not only a moral and ethical imperative that we should have, and we need to have a more equitable access to vaccines. It is also a public health imperative, because if in any country the transmission is not controlled, we can see new variants of concern rising. This is the natural process of this virus, and we can have it totally by chance. We cannot predict this, to have one of these variants not being protected by the current vaccines. So it's very important to protect everybody, giving more access to vaccines to every country in the world. The WHO has made a very clear recommendation for third doses that is based on the scientific evidence that is available. This recommendation is that for vaccines that have the same technological platform, vector viral, that is the Sinopharm and Sinovac vaccine, people that are at 60 and older, and the people that are immunocompromised should receive a third dose as part of a regular vaccination schedule. For all the vaccines that have EUL, Sinovac, Sinopharm, Pfizer, Moderna, and AstraZeneca, these vaccines, people that have for some reason, a problem with their immune system, and this can be related to some medicines, can be related to some immune diseases and others, these people should have a third dose to increase their protection. So this is the recommendation that we have from WHO. Of course, this recommendation needs to be applied in a smart way in each country. If you have limited access to vaccine, the priority is to vaccinate the 20% of most vulnerable people, is to increase the vaccination to achieve a very high level coverage that can reduce the transmission. Let's see that the vaccines have a double effect. It has an individual effect. It can protect and save the life that the people, that a person that receives the vaccine, but it always has a collective impact. Because if we achieve 75, 80, 85% of coverage, this together with the public health measure can reduce the transmission. So this will protect everybody. So the real better way to get everybody protected is increasing the coverage of the vaccine in every country in the world. Thank you for this question.
Gracias, doctor Barbosa.
Thank you, Dr. Barbosa. The next question in the chat is by Gerson Coyabi from El Comercio in Peru. He's saying that in Peru, they're still using some protocols that have not proven to be effective against COVID-19, such as disinfecting shoes with alcohol. So what is WHO's recommendation as to the updating of health measures, and what are the measures that should be discarded? Dr. Ugarte. Thank you for this question, Jason. And it is important to explain how the virus is transmitted. We previously explained that the measures that have proven to be highly effective are wearing a mask, disinfecting hands, physical distancing, and these are the most important. Clearly, in some areas and in some environments, such as hospitals where you see aerolized substances, the health workers need to be properly protected because risk increases. So person-to-person transmission takes place when there is a relatively close contact among individuals that are not properly protected or that have some respiratory symptoms and they are not implementing respiratory hygiene. For example, cover their mouth when coughing with tissue or with the inside of their elbow. So at the same time, we need to strive for vaccination so that risk diminishes as well as the transmission of the disease in general. The disinfecting surfaces, in particular surfaces that may have been in contact with many individuals, many persons is important, but transmission has been proven is from person to person. And the other ways of transmission pose a much lower risk. So touching a surface and taking hands to face, nose, or mouth is a significant path for transmission, but from the point of view of disinfecting shoes, it is not a path for prevention of COVID-19. So we could clearly understand transmission, or whenever we have environments that create aerolized or sprayed substances, or for example, when we think of restaurants or public places where this stays up in the air for a long time. So there you have a risk in connection with shoes and other surfaces that hands are not in contact with, have a very, very low risk. Thank you, doctor. The next question is by Blanca Valadez from Millennium Group in Mexico, and similar questions are as follows. Whether Cancino has already provided their documentation to WHO for their approval as part of the emergency use list, and what is missing? And the same applies to Sputnik. What is missing and what are the requirements that have not been met? Dr. Barbosa, thank you. Thank you for these questions. Let me clarify the regulations to authorize a medicine or a vaccine. For many, this is just red tape, that it is just for the producer to provide a file, a document requesting authorization overnight. This is not the way it works. The regulator first has to look at the quality of manufacturing, whether the factory that produces the vaccine agrees with the good manufacturing practices published by WHO. That is part of international standards. Second, all of the data needs to be reviewed, all of the clinical trials that took place with that vaccine to make sure that they are vaccines that are safe and efficacious. So that is a process that in regular times may take several months, and it is related to the quality. And if the producer provides all of the necessary information, because whenever information is missing, the regulatory authority will always request more information to be certain of the decision to be made. So oftentimes there is a process of sending information, requesting more information. This is part of the regular process. During the pandemic, the regulatory authorities in each country, as well as the World Health Organization, have adopted more expedited ways to authorize vaccines. And for example, the authorization for emergency use. This is an expedited way, but also entails checking the quality of manufacturing, the safety of the vaccine. And these are processes some processes are faster because the manufacturer produces or provides all of the package with the information. Other producers may take longer because the regulator or WHO may be requesting more information. So these are processes that are being used by us, and the more vaccines we have available for emergency use, the better, because this will also imply greater access, and also, regardless of the country producing the vaccines, more producers may offer the vaccine for COVAX than the regulatory system, but the process has to follow the same criterion, and it is a completely technical procedure that is the same for all producers. Thank you very much. Thank you very much, doctor. We have an ambulance out here going by. Just a second, please. We apologize for the noise. This is a question about Venezuela and vaccination in the country and the doses sent through COVAX. Is there any update? This is a question by Mariana Garcia from Crónica 1, and also Mariana Suquet is asking something similar, whether they have already received the COVAX vaccines and when new doses would be sent, and whether Venezuela has already stated any interest in procuring other vaccines through PAHO's revolving fund. Dr. Barbosa. Thank you for the question. Venezuela, fortunately, well, at the outset, we had some issues, but fortunately, we have been working with the Ministry of Health, with the administration, with all of the partners, and Venezuela has agreed to all of the rules of the COVAX facility. Venezuela has already received about 3.3 million doses, and they have another 3 million doses that will be received next week. This will be supporting the vaccination efforts in the country, and it is important that throughout the rounds to allocate vaccines, we asked the countries in the Americas what preference they have, whether they are interested in receiving one vaccine or the other, and based on that information, we work with the producer and with the country to improve all of the legal administrative processes, payments, and regulatory processes. So we hope that Venezuela, as well as the other countries in the region, may have more vaccines to attain vaccination of their population. And together with the public health measures, this vaccination will also control transmission. Thank you very much. Thank you, Doctor. Another question about vaccines that we have received is, what do we know about the safety of the COVID vaccines? Thank you very much for this question. Unfortunately, COVID-19 vaccines oftentimes are the subject of fake news that are completely unfounded, and they are also leading to vaccine hesitancy. So we are always supporting countries for them to have communication strategies with the population, for them to identify what are the doubts they have, so that they can provide information to health workers and to other colleagues, so that they can answer questions that the communities and the families may have. But there is a great deal of misinformation about COVID-19 vaccines. These are not candidate vaccines. These are vaccines that were developed in a short period of time due to an unprecedented investment of million dollars by governments and by the industry to develop these vaccines. These are vaccines that followed the whole process to be followed by a vaccine to be authorized for use. They were part of clinical trials that took place in several countries. So these are vaccines that met all of the requirements to ratify their safety and efficacy. The data we have speak for itself. So they have already saved millions of lives all over the world. We have more than 9 billion doses of various COVID-19 vaccines that have been administered all over the world. In the Americas, more than 1.2 billion vaccines have already been administered. And this is in some countries that have very strong surveillance systems to identify each of the adverse events that all of the vaccines, that all of the medicines may have. Those events are reported to the health ministries that review them in general with a specialized committee, an independent committee that conducts that review to make a decision. Also, within PAHO, we have a committee on the safety of the COVID-19 vaccine with several experts from several countries of the region that independently reviews all of the adverse effects in the country. And the conclusion is that most of the adverse events and adverse events that are mild are quite similar to the ones we see with other vaccines. And these are vaccines that save lives. The benefits of these vaccines that, in addition to saving lives, also prevent hospitalization and severe forms of COVID-19 are several times higher than the adverse events that we observe today. In addition to all of the reports we have from countries that have strong surveillance systems and that are monitoring the situation, we have more than 50 studies that have been published in very serious journals that ratify the safety and efficacy of the vaccines. This is one of the vaccines that has been studied the most all over the world because we have a deep interest from the academic sector, from the scientists, and also the health sector. COVID-19 vaccines are safe and they can save lives. Please do not listen to fake news that continue to spread, and do use the vaccine to protect your family and also your community. Thank you.
Muchas gracias, doctor. Y estamos ya llegando a la sesión, al cierre de la sesión.
Thank you very much, doctor. We are reaching the end of our session today. We have a question related to the next meeting of the G20 ministers, and the question in English is,
meeting of ministers of health and finance of the G20 in Rome, and what can these countries do so there is a more equitable distribution of vaccines? Dr. Barbosa.
Thank you for this question. There is a great expectation about the outcomes of this meeting. We are in October, almost in November already, and we still have many countries, many poor countries in the world, in Africa, in Asia, and here in the Americas, that have not yet vaccinated at least the 20% that are the most vulnerable groups in this country. So we expect that the leaders that will be that will attend this meeting can make a strong commitment to guarantee equitable access to the vaccines. Solidarity now can be translated in one concept, that every country needs to have the vaccines to protect their population, that each country in the world needs to have access to vaccines to protect the most vulnerable groups and to control the transmission. So we cannot think that is possible or acceptable to reach the end of this year with countries that have not yet reached at least 40% of their population vaccinated. So we do believe that these countries can have a strong commitment to make more donations, to tell the producers that they should split their production, not only to attend the bilateral agreements, because in these bilateral agreements, they are making more profits than the vaccines that they are delivering to mechanisms such as COVAX or the revolving fund. So if you have a more equitable distribution of the vaccines, if you have more donation, we can reach the end of this year with this objective that was established by WHO, with every country reaching at least 40% of their population fully vaccinated, and thinking about having the first semester of next year, all the countries reaching at least 70 or 80% of their population vaccinated. PAHO is doing is implementing all the measures, all the initiatives to increase the access for the countries in Latin America and the Caribbean. We are working through COVAX to expedite the process to have more vaccines, but the reality is that the producers are prioritizing the bilateral agreements. We are working with the countries that are donating, and we thank and we are grateful for this donation, but we need more donations to be channeled to countries in Latin America and the Caribbean, and we are also working with the countries to reduce the vulnerability that you have in Latin America and the Caribbean, to increase their capacity to produce vaccines, medicines, medical devices, personal protective equipment, and other many important tools that you need to cope with this pandemic and future pandemics. So we all hope that this new meeting will send a very clear message that nobody will protect it, while we have countries in our region and in the world that have less than 20% of their population vaccinated. More vaccines to every country, I think that is the clear message that we want to hear from this meeting. Thank you.
Muchas gracias, doctor Barbosa. Ahora sí.
Thank you very much, Dr. Barbosa. We have now reached the end of today's session. Thank you again, Dr. Barbosa, Dr. Ugarte, and Dr. Aldigueri. And let me remind you that you can find further information on COVID-19 and the regional situation of the pandemic, as well as vaccination in the Americas, on our webpage, PAHO's webpage, www.paho.org. Once again, thank you for connecting, and we will be in touch. Greetings.